Today, I'm joined by Hunter Ziesing, the co-founder of Longevity Health, a company that's redefining how we approach preventative medicine. Hunter's mission is to move healthcare from being reactive to truly proactive, combining advanced diagnostics, personalized data insights, and human-centered care to help people live longer and healthier lives. Welcome, Hunter. How are you feeling this morning?
I'm feeling great. Thank you very much for having me on.
It is a pleasure. Let's get into it. You often describe longevity health as a movement from sick care to proactive wellness, but that shift just isn't medical. It's psychological. What have you found is the biggest barrier to helping people emotionally buy into preventative care, even when they can afford it?
Well, a couple of things. I think people largely want to be healthy. They go to the doctor every year and the doctor says, you need to do this, you need to do that, and you're usually good for about a month and then you sort of drop off. And part of the problem is motivation. Part of the problem is having, access to the right tools that, are specific to your own biometrics.
Hmm.
Um, and analyzing those tools to sort of figure out, what your you know, plan of action should be throughout your life for better healthcare.
Hmm.
And from a motivational standpoint, I think people lack not just the tools, but they lack motivation because they don't really have a social element around them to focus more on preventive health. And it kind of gets lost in the shuffle. And they're motivated, they just don't have the tools. They don't have the social elements, as I said before, to react with other people in their groups to become more healthy. And then finally, there's an affordability issue in America right now. There's a lot of new, really interesting functional tests that you can do for preventive health that aren't being utilized largely due to affordability.
Mm. That's interesting. When you were talking about the social aspect of it, could you elaborate on that? What you mean by that affecting how they go forward or take the
Sure.
action steps?
Prior to founding Longevity Health, I've been in the health space for about 15 years, largely
Nice.
fundraising for large cancer research centers
Nice.
and preventive health. And for 2 years, when I left that, I joined a company called Paceline. And Paceline is a company that you put a wearable device on your wrist, either a Garmin, a Fitbit, or an Apple Watch, and it tracks your heart rate. And each week, you elevate or exercise your heart to something above your resting heart rate, and you accumulate 150 minutes of elevated heart rate each week, which is what the World Health Organization recommends for a healthy adult, just to elevate your heart rate
Okay.
150 minutes a week. And you
Wow.
think about it, the key elements in health are diet, exercise, and sleep. And exercise is a huge problem, as you know, in America. But at Paceline, each week when you got to 150 minutes, we would pay you $1, like an Amazon gift card. And there were some social elements to it. And uh,
Ah, I
each
see.
week you would hit a streak, and then week two, week three, week four, week five, and so on. And if you didn't hit your 150 minutes, your streak would go back to zero. And it was amazing to watch people literally, they'd be at 140 minutes on Sunday afternoon when it was about to reset to zero at midnight, and they go outside and run around the block. In fact, we even had cancer patients receiving chemotherapy in um, clinical facilities that they brought in exercise bikes so they could hit their 150 minutes or treadmills. And it was a highly motivating. I guess what we learned there is people and they also followed each other like on Facebook and groups.
Mm-hmm.
It's like, hey,
Yeah.
Hunter, you've done your exercise. Susan hasn't. So there was motivation to sort of work with other people to exercise. The challenge was that most of the people that utilized the app, I think we had 1 million downloads over time,
Hmm.
were largely people that were already healthy and already
Mm.
exercising. And
Mm.
the challenge that we're trying to do long term with AI and gamification is to change people's behavior by finding people that really need to, find exercise regimen. But anyway, what we learn is people are motivated by social and some by money to exercise.
That makes sense. I would tell you I probably fall under that category if I'm being reminded that someone else has done their, homework or their job. I could see myself wanting to be competitive in a healthy way to, get to my goals. So I think that incentive is really important. Um, I wanted to know what major shifts are you seeing in the industry right now? I know there's a lot of people doing things that you're doing, but how would you say you differentiate from other um, companies like this yourself?
Well, the problem in the industry right now is, first of all, when you go to your doctor, you get a simple blood test maybe every year, even if you get one, maybe an EKG. The medical system really doesn't support um, currently many of the tests that are coming into the marketplace, like oxygen chambers, blood tests, comprehensive blood work, DEXA scans, which is only a $75 um, MRI-like exam that tests for visceral fat in your body, and it
Mm,
also detects bone density. Gut health is becoming very common. And by the way, DEXA scan, any woman or man over 40 should get one. I think the Health Association recommends over 60, but largely for women, by the time you discover you have osteoporosis, it's too late. Interestingly, sidebar, I'm an avid athlete, cyclist. I don't lift weights, and my DEXA scan showed a few areas of visceral fat in my body that I should be aware of. It also determined that my upper body was probably more like a 75-year-old, and my lower body, being a cyclist, was more like a 30-year-old. So I've since changed my plan to start exercising. Um, Diet is another huge consideration. But again, the problem with the space is that there are so many people looking at these tests or doing these tests, and then they're really not following up because they don't know what's right for them. I guess there's conflicting guidance. There's many blood tests, and you can get a lot from a blood test. But often these blood test companies are recommending drugs and supplements for people, which is helpful, but it's not longitudinal, it's not comprehensive enough. And then
mm,
lastly, as I mentioned before, the medical industry, your doctor is not compensated for prescribing a lot of these incredible tests that are coming into the marketplace. Uh,
mm,
the insurance industry doesn't cover it. Employers, in some cases, are covering um, these tests, but in the HSA plans, but it still has not yet become mainstream. So that's one of the challenges we have is the lack of medical support. In fact, I don't know if you're a skier, but if you go to your doctor with your DEXA scan and your blood test and your gut biome test, it's and ask for advice. It's kind of like walking into a ski shop with your boots, your bindings and skis that you bought on Amazon and your jacket, and saying, "Hey, can you mount my bindings for me? And here's $100. And oh, by the way, my zipper on my jacket I bought on Amazon is broken." And they're going to say, "Well, you didn't buy it here. Why are you
mm,
coming to me with all your equipment that you bought on Amazon?" And it's the same thing with physicians. They just don't know what to do with all this information and they're not compensated for it. So what we
mm.
really need to change is reimbursements for insurance so that people can figure out which tests they need for their biological profile and their objectives, and then
Yeah,
get compensated for those tests.
yeah. I've talked to a lot of chiropractors and physicians and on my podcast, and that's one main problem that people talk about is the reimbursement. And so they like how a lot of chiropractors offices are now like doing B2C where they're not even taking insurance and they're just helping the client just because it's such a pain when it comes to the doctor insurance relationship. So it seems like it's a major obstacle in the medical healthcare like industry. So I find that to be really interesting.
And a lot of people are paying out of pocket now.
That's what I'm saying. That's what I actually personally do. I have Medi-Cal, but just because of the process sometimes and I need to get seen at ample time, I'll just pay out of pocket. And I've noticed that's becoming a new norm. So I would imagine that's great for your business, right?
It is, but we want to see reimbursement change for some of
Yeah,
these functional tests. But people are paying out of pocket, but it's largely only for people that can really afford it. So we built a
right.
longevity clinic. That's our company, and it's an online longevity clinic.
Okay.
Expensive. It's $11,000 a year, but we do 6 comprehensive tests, and then we give you a medical advisory board of a clinician, a doctor, an MD who can prescribe medicine, an exercise physiologist, and a nutritionist. And then we develop a plan for you based on what you're looking to achieve and what your
Mm,
biomarkers say. And then we retest every quarter. So not all the tests, but we generally redo the DEXA scan and the blood test. And we also
okay.
give people a CGM for about a month. And then we kind of look at all that longitudinal data, make recommendations, and then plan and then retest. And again, it's $11,000 a year. It compares to $20,000 to $30,000 for a bricks and mortar clinic. Where
Okay.
you go into a facility, you do all the testing. They're nice, they wine and dine you and serve you nice herbal teas, and then they send you on your way. And
Yeah.
we found there's very little follow-up with an online practice. We find people to be much more reactive because we give everybody a Slack channel, or email or text, and you can reach out to your doctor 24 hours.
Okay.
And
So,
that's been very successful. But I'd also point out you don't need to spend $11,000. There's so much you can do on your own. With longevity, you're going to have to pay for some tests, but you can load a lot of your data into ChatGPT, and it'll give you some pretty incredible results. And it's about 90% accurate.
mhm.
So what we're doing now is building an AI version of our longevity clinic that will be as little as $100 a month and eventually $10 a month.
Oh, nice. And elaborate what that would be like. What does that do for the customer, this new innovation?
So what AI does, oh, and by the way, just AI, you know, 15, 20 years ago, you could search when you had some condition on Google,
Hmm.
and it was very confusing. In fact, when you read it, you think you're going to die. You read about all the symptoms you have and what,
Yeah.
what's going to happen to you. Now with
Yeah.
ChatGPT, it's amazing how accurate it is. And it's also frustrating because I know more about myself than my doctor does just by putting my medical records into chat. And it doesn't develop a plan for me. It's a little bit wonky. Sometimes it makes mistakes, but I went I went to took me 6 weeks to get an appointment for an allergist. I went into the allergist. Before I went in, I put in all my information in chat, and it said I needed this blood test and I needed a skin test. So I go to the physician, 20-minute drive. I was there for an hour, and they said, you need a blood test and you need a skin test. I'm like, well, I already knew that. And my insurance covered it, most of it. And then they said, well, you need to come back in 6 weeks to get your skin test. So it's kind of frustrating. I already knew what I needed, and I have to
Yeah.
come back. And the insurance company has to pay for 2 visits. So anyway, to answer your question, what we can do with AI, and this is what we've built now, and we can call it and I can show it to you. It's pretty cool. It
Okay.
it interviews you, a verbal chat agent, asks you about your lifestyle, what you want to achieve. You can download tests into the platform. It's on an
Okay.
AWS secure server. It analyzes all your tests, all your health records, and then it makes recommendations and then develops a plan for you. And
Okay.
what AI does is it takes, not that we want to dissuade from using clinicians and doctors and dietitians, but it's very expensive. Teledoc is can be very expensive. Every time you call, it's $100. AI can replace a lot of that.
And so, if you don't mind, could we do an example?
Yeah, so I've already gone through the onboarding, and I've been calling this thing on a daily basis. So let me see if I can find the number here. I'll call it and I'll show you how it works here. And again, it reads all my medical records.
Hmm.
And I just had a blood test put in, so I'm going to quickly just ask it about my blood test.
Okay, nice.
Let's give it a call.
Okay.
Hello, this is Jesse from Longevity Health. How have things been going for you?
It's going pretty good. Could you quickly give me a short summary on my recent blood test? Because I'm going to get another one in a couple of months and compare the results.
Great to hear things are going well. Let's dive into your recent blood test results. From the last test on August 9th, 2025, there were a few key points to note. Your bun to creatinine ratio was elevated at 26, which might suggest dehydration or a renal issue. Your insulin level was low at 2.3 microunits per milliliter, and your FSH was elevated at 13.4 milli-international units per milliliter.
That's great.
Which could reflect hormone.
That's great. What about my DEXA scan?
Your DEXA scan from July 11th, 2025 showed that your body composition and bone density are in good shape. Your BMI was 24.4 and your total body fat percentage was 24.7%, both within the normal.
So you get the idea. I was a little heavy when
Yeah.
I did that test. So 24 is pretty high for a cyclist. I should be around 22 BMI. So when I get my next blood test and my next DEXA scan, it'll automatically load into my file and
Okay.
it'll read it and send me a message and compare the results. And it'll develop a plan for everything from nutrition, diet, weightlifting, anything that's specific to me. And
Okay,
when I
wow.
first onboarded, I expressed concern about Alzheimer's. My mom had dementia. My father had pancreatic cancer, and a few other, family history things that I just put in there. So it reminds me, and I'm getting messages about, brain health.
Yeah, no, that's very innovative and informative. I wonder, so I'm assuming with this, is this out to the public or is this right now being tested and still monitored before people have
We
access?
just started a beta trial
Okay.
last week with 40 people. I think we're open on a few if anybody wants to join it.
Okay.
It's ranges from 79 to 300 a month.
Okay.
Different variations of pricing depends on how much testing we provide and how much access you have to a medical doctor. But in all these cases, it's AI plus human in the loop. So there's always
Okay.
going to be a medical doctor or clinician looking at your data because AI, as much as everybody thinks it's the be all end all, it's not entirely ready for prime yet. One, consumers aren't fully ready for the driverless doctor. In San Francisco, you jump in a Waymo. Maybe in LA, I'm not. Do you have Waymo down there yet?
Yeah, we do.
Yeah, so you're familiar with Waymo, and you feel safer around a Waymo probably than you do a regular
No,
car.
I do. They yield a
Right,
lot.
but when they first come, people kind of run for the curb. So people aren't fully ready for AI.
Yeah.
AI is not 100% ready yet because it still makes mistakes. So over time, we're training these large language models how to become a better doctor, how to be more
Yeah.
accurate by looking at large data sets. And so that's going to take some time. And then from a regulatory standpoint, AI is not fully ready yet because it's not adopted legally yet to prescribe medicine and prescribe blood tests and to prescribe procedures. But I think that's coming. I don't know if it's 3 years or 5 years or 10 years
Yeah.
or 1 year, but eventually we feel that AI will replace your primary physician. And that's where we charge $10 a month for the platform and we go out to the masses with it. So you control all your own data, but the data is kind of useless unless it's analyzed. And then
Hmm.
when you need a procedure done, we'll refer you to your physician or you'll know who your physician is. So you'll walk into your physician like I did at the allergist saying, this is what I need. Kind of like your brake light goes on your car, you need brakes, or your oil light goes on. Check engine. We'll have a check
Right.
light on the app.
Right. And I feel like that's one really unique thing about this and just the innovation of AI in general. A lot of people have a problem with continuing to monitor their health because of convenience and accessibility and resources. So I think that allows people that are parents, busy children, don't have like a lot of time to go drive all the way to the clinic, come back. It gives them ample opportunity to prioritize their health. So I find that to be really great because I think that is a major issue for people. I wanted to switch gears here and ask you a little bit more of the business side of questions. What do you think is like working well for you right now, and what do you find to be a little still frustrating when it comes to the business?
Our $11,000 product is doing very well. We call it the billionaire bundle. Not that people like billionaires, but it's close by what a billionaire would get for $11,000. That's going extremely well. And most of the people that have gone through the program are renewing. It's a profitable business for us. I wouldn't say we're making a lot of money off of it, but it's great to have that as a lab because we are a full medical practice. What's
Hmm.
frustrating me right now is that a lot of venture money has been raised for vertical testing companies, which helps us and helps consumers because there's more and more tests out there that you can use for preventive health and to look at your overall picture. But what's frustrating is that the consumers are a little bit confused right now by conflicting advice, and these companies, such as some great blood test companies that are really just repackaging a LabCorp or a Quest test and putting a fancy, skin on it, charging you $500 and then selling you a bunch of supplements. So people say to me, well, why should I spend all this money and get all these additional tests if I can just get a blood test and solve all my problems?
Yeah.
And so far that frustrates us because consumers are being confused by that. And for the most part, none of them are really providing any actionable plan to change health. Because that's ultimately my goal in life for my legacy is to change the nature of preventive health using individualized data and
Hmm.
then using gamification and socialization to get people moving. As you said, accessibility. You said three things. I can't remember. Accessibility is one of them, but an actionable plan to get people motivated to change their behavior.
Yeah. And just to remind me, when you were talking about the bundle, what I know that's not the only bundle that you guys offer. What are if someone goes to your site, and if you can explain it in layman terms, what exactly do you guys offer to individuals outside of just the bundle, if that is too, out of their budget? What are other things they can do
We
to
we
get
have a
started?
we have a product called a check-in, which is $2,500. Um, we do 4 tests. You just don't have as much access to the MDs as you might with the full billionaire bundle package.
Hmm.
And then, are you able to send a link around with your web
A link around? What do you mean?
when you publish the
Oh yeah, I'll have it in the description box.
yeah, I'll send you 2 links, one to longevityhealth.me and another
Okay.
one to ai.longevityhealth.me, which is our beta test.
Okay.
And with that one, as I mentioned before, the first price point is actually $79. That
Hmm.
gives you consultation with a medical professional, a doctor, and full access to AI, a place to keep all your information. It gives you a
Hmm.
plan, just like I was just talking to the AI agent. That's
Yeah.
$79 a month. For about $179 a month, we include a DEXA scan and a blood test. And then there's another package we're working on for around $300 that gives you more access to the physicians and another test.
Okay.
That's where
Nice.
that's in beta right now.
Okay. And what would you say, what metrics are you most focused on improving right now in the business?
For individuals or when you say the
Just,
business?
I mean, just I mean, it could be about individuals, but as the business in its whole, when it comes to, I don't know, maybe streamlining, optimizing operations, what would you say is something that you're focusing on improving within the platform?
Oh, great question. Making it just really easy to use, a strong, login user experience, training the AI to really get to know you so it
Mhm.
becomes your friend.
Yeah.
In fact, there was a movie 25 years ago, I'm dating myself, called Her with Joaquin Phoenix, and he falls in love with a computer.
Oh yeah, I've heard of it. I haven't seen it, but yes.
Yeah, yeah. And then just making it really seamless so that when you get a blood test with one of our test partners, it automatically loads into your account and it's analyzed right away. So you don't have to do anything. It's all pretty
Okay.
much done for you. And then building the app in a way that it's constantly giving you subtle reminders about your health regimen.
Awesome. Those are really good goals. I'll ask you one more question and then I'll let you go. Where do you see your business being? What would you like your business to be 6 to 12 months down the line? What's your vision? How do you want to see it? I mean, we've gone over, the metrics and the overall philosophy, but if you can give me the whole picture, what would you like to see your business 6 to 12 months from now?
I'd like to see several thousand people on the new platform, the AI plus human. And hopefully through this trial, we'll learn from our participants as to how to build it, let them build it for us. It's a paid
Hmm.
trial, you have to pay, but we're really going to use people to help build this so it fits what people need. Um, and at that point, hopefully we'll have several thousand people on the platform. We're working on a couple of pilots right now, which is going to be
Okay.
business to business, where we will be testing it inside a company where the HSA plan will pay for it. So that's the
Mm.
next phase. And then
Yeah.
that's 6 to 12 months, 6 to 10 years is, 1 billion people on the platform from cradle to death.
Okay. Nice.
And it
Uh,
might be free. It might be free.
Oh, wow. That would be great.
Our plan is, $5 to $10 a month, but I think at that point, if we can prove that we can look at individualized data,
Yeah.
we can specify which data that you as an individual need. We
Hmm.
think that companies will pay for the tests.
Mm.
Because right now, when you go to your large employer, they're like, "Hey, here's a subscription to Calm, and here's a heart monitor and a gym membership. Go
Yeah.
get healthy. You're on your own." We're like, "No, no, no, no. Susan is 42 years old. She has risk of osteoporosis. She has this in her family history. These are the tests that she needs to get done."
Yeah.
So we can very much specify what each individual needs. If we do that, we think employers will pay for it. Eventually, insurance companies will pay for it. And then, God forbid, down the road, Medicare.
Yeah.
I've heard numbers as high as $4 trillion a year is spent on end of life care in America, of which half could be avoided if we ended obesity and got people more in front of their health. It's a huge problem. And people have, are predisposed to certain diseases that they can't control.
Hmm.
But for the most part, people's health span can be improved by getting in front of your data,
Yeah.
predisposed issues. And then the challenge is getting people to do something. And that's where gamification comes in. But again, it's a long answer to your question. Why shouldn't everybody in America have a platform like that that's affordable, that guides
Hmm.
you throughout your life?
Absolutely. I agree. And I was just curious, how are you currently outsourcing y'all's customers? Because it's such a unique platform. I'm curious to, is it referral based? Is it out, can anyone look you guys up? Is it you guys have, outbound cold emails reaching out to the masses? How are y'all currently bringing people to your website?
Great question. We're focused for the billionaire bundle. I've been focusing on wealth managers,
Okay.
registered investment advisors.
Okay.
Most of our inbounds come from Google search. So we run ads on, through Google, and people are looking for longevity, health span, some keywords, and they find us. We've done some work on Facebook and Instagram, but it's a little bit more noise. So you really have to find people that have had a health scare, or they're at a pivotal point in their life where they want to make changes. So that's how
Okay.
we've been finding them.
Okay. Yeah, that's great. And that's going well, like the ads and stuff. You guys feel like you got that locked down.
I wouldn't say we have it locked down. We just hired a digital marketing agency, and we're going to expand some of our marketing efforts.
Okay, awesome. Well, thank you so much. Seriously, it's been a pleasure talking to you, Hunter Ziesing.
Ziesing, yep.
Ziesing. I really appreciate your insights and your wisdom. And please remind everyone where they could find you. I'll have it in the link, and the links in the bio. But just remind the audience real quick where they could find you and learn more information about.
Longevityhealth.me.
Mm-hmm. Longevityhealth.me. Okay. Any LinkedIn, anything like that?
We're on LinkedIn as well. And I'm Hunter at LinkedIn. Hunter at LinkedIn. Hunter at longevityhealth.me.
Okay, awesome.